Hi, I'm Alex, and I worked with Christy Leafling to research and present health issues that incarcerated adults face even after they've been released back into society. Imprisonment is a widespread punishment all over the world, but prison is, for the most of us, an unknown experience. Most everything we do know is mostly through media and cinema representations. The public hears about prison when there are riots, hunger strikes, escapes, or releases of dangerous inmates. Events heavily covered on mainstream TV, news, newspapers, and social media have helped create a culture climate that is negative regarding this population. In some cases, these portrayals are accurate, but they do not encompass every felon or inmate. This type of profiling puts this population at risk for misjudgment. Incarceration, parole, and probation forces the separation of families. The separation caused by incarceration, as well as the barriers to sustain meaningful contact while incarcerated, has been shown to impede re-entry into society and create profound challenges to family stability. Actions of family members toward the incarcerated felon population will have an effect on the inmate's perception of their sentence and chance of reoffending. Lack of family support for felons and their families can have detrimental effects to everyone involved. Studies have shown that prisoners who maintain consistent contact and connection with their families during their sentences have a lower recidivism rate than those who do not. It has been suggested that social interactions amongst prisoners and former felons can increase their criminality and thereby encourage their reoffending. Peers can instigate or reinforce positive behaviors and outcomes, just as they can negative ones. These effects depend on the characteristics of the peers in question. It is still important to have positive peers for people in this vulnerable population to encourage and offer needed support for them. About 45% of federal inmates are rearrested within 5 years of release due to factors such as homelessness, substance abuse, educational illiteracy, and lack of vocational and interpersonal skills. However, a major contributor to this cycle is the difficulty in obtaining a job once released with a conviction record. In fact, labor statistics show that 89% of formerly incarcerated people who violate the terms of their probation or parole are unemployed at the time of the violation. Life after prison doesn't start with a clean slate. The obstacles faced are part of the collateral consequences of a criminal conviction. Collateral consequences also include the unofficial social stigmas that confront ex-offenders, such as trouble finding a job and the damage prison does to the individual's skills and abilities. Some estimates speculate that today's ex-offenders could face up to 50,000 legally mandated collateral consequences, including restrictions on housing, employment, public benefits, and immigration. When prisoners in the United States are released, they face an environment that is challenging and actively deters them from becoming productive members of society. After serving time in prison, ex-offenders are released with significant and ongoing economic and social obstacles that often prevent them from thriving, thus indirectly pushing them back to crime and back into the prison system. These obstacles include social stigma, discrimination, learning new technology, and rebuilding the life around them. At least 11 million people are sitting in prisons and detention centers all around the world. Some of the worst places for inmate treatment are listed here. The Diyarbakir prison in Turkey and Camp 22 in northeast North Korea both subject inmates to extreme mental and physical torture, including sexual abuse and human experimentation. Those with lower education levels and those who come from lower socioeconomic communities demonstrate a higher incarceration rate. While in prison, prisoners receive an average of less than $1 for jobs. Further, once released, the incarceration on their record limits their employment opportunities, which in turn restricts financial gain and access to employer-provided health insurance. Race and ethnicity affect the incarceration rate of the population, and therefore increases the health risks associated with imprisonment at a higher degree. For example, 1 in 36 Hispanic men and 1 in 12 black men are incarcerated, while only 1 in 87 white men are incarcerated. Religion and spirituality provides many benefits to prisoners, past and present. It can improve coping skills, which result in better mental health. The sense of peace and calmness it can provide helps to reduce violence and the threat of physical harm. Once released, religion and spirituality helps transition inmates back into society, improve outlooks of employment, housing, and resources for well-being, while also helping to reduce reincarceration. While both male and female inmates demonstrate poorer health when compared to the general public, women appear to carry a heavier burden than men while incarcerated. Incarceration negatively affects women's health more than men's, with chronic health conditions, mental health, and substance abuse, all of which that follow the individual even after release. Further, women are being released from prison have an extremely high risk of death compared with non-institutionalized women. Prisoners, inmates, and previously incarcerated adults are put at a health disadvantage in rural institutions. Due to the distance and reduced public transportation, family visits are greatly hindered and negatively affects an individual's coping and mental health. In regards to the medical staff, it is more difficult to hire and retain quality specialized staff. Telemedicine does help address this concern. However, in acute health crisis situations, extended travel times to hospitals put individuals at a greater risk. Once released, rural areas lack reintegration resources, which pushes individuals back into urban areas. A predominant bias for prisoners across all channels is the implicit and explicit bias of race. Non-white men and women are more likely to be stopped and questioned by police, are more likely to be charged of a crime, and receive harsher and longer sentencing than their white counterparts. The bias of race in the prisoner population is sometimes unconscious and implicit for some, while others are upfront and outspoken on their views regarding race as it relates to criminal activity. European prison systems seem to have the upper hand in terms of prisoner health care. In 2006, the Committee of Ministers of the Council adopted the European Prison Rules, which includes a significant section on health care in the prison setting. Specifically, it is outlined that prison authorities are to safeguard the health of all prisoners and provide medical services that mirror general public health. Some examples are Norway, Scotland, Spain, and Switzerland. Norway has a continuing care policy whereby everyone released from prison will have access to services to help them with housing, employment, and health care. This contact with community service begins well before they are released. Scotland has a special focus on helping inmates transition back into civilian life in a purposeful and meaningful manner. A prison in Spain allows infant children to live with their incarcerated parent for the first few years of their life. And in Switzerland, prisons have spacious cells to prevent the ill effect of overcrowding and confined.